First question. A 5-year-old child presents with developmental delay, self-mutilation and hyperuricemia. Urine analysis reveals orange sand-like crystals. Which of the following pathways is most directly impaired in this patient? A. Purine salvage. B. De novo purine synthesis. C. Pyrimidine synthesis. D. Urea cycle. Answer A. Purine salvage. Explanation. This is Lesch-Nyhan syndrome caused by HGPRT deficiency, leading to impaired purine salvage and increased uric acid. Remember that they will rarely ask if it is Lesch-Nyhan syndrome or not, but often will test you on the mechanism. Next question. A chemotherapy drug works by inhibiting thymidylate synthase, decreasing DTMP production. Which base is directly affected by this mechanism? A. Uracil. B. Thymine. C. Cytosine. D. Guanine. Answer B. Thymine. Explanation. 5-FU inhibits thymidylate synthase, blocking DUMP to DTMP conversion, limiting thymine availability for DNA synthesis. Next question. A researcher introduces a cytidine analog into a DNA strand. Over time, the analog is found to deaminate spontaneously. Which base is this most likely to become? A. Adenine. B. Uracil. C. Thymine. D. Hypoxanthine. Answer B. Uracil. Explanation. Cytosine deaminates to uracil. This is a common form of spontaneous DNA mutation corrected by base excision repair. Next question. A patient is given a medication that increases DNA melting temperature. Which base pair ratio has most likely increased in this patient's DNA? A to T. B. G to C. C. U to A. D. T to A. Answer B. G to C. Explanation. CG pairs form 3 hydrogen bonds. More CG pairs increase DNA stability and melting temperature. This may seem too easy, but remember this point and you will thank me later. Next question. Methotrexate is a folate analog used in cancer treatment. It ultimately leads to inhibition of which DNA base's synthesis? A. Guanine. B. Adenine. C. Thymine. D. Cytosine. Answer C. Thymine. Explanation. Methotrexate inhibits dihydrofolate reductase, decreasing tetrahydrofolate and DTMP synthesis, affecting thymine. Next question. Which antimetabolite targets purine synthesis and is converted intracellularly to thio-IMP, inhibiting several enzymes in the pathway? A. Methotrexate. B. 5-fluorouracil. C. 6-mercaptopurine. D. Hydroxyurea. Answer C. 6-mercaptopurine. Explanation. 6-mercaptopurine, 6-MP, is a chemotherapy and immunosuppressive drug. It's primarily used in the treatment of 1. Acute lymphoblastic leukemia, Crohn's disease, and ulcerative colitis. 6-MP is activated to thioinosine monophosphate, which inhibits purine synthesis by blocking amidotransferase and other enzymes. Metabolized by thiopurine methyltransferase. Major side effects: myelosuppression, liver toxicity, nausea, increased infection risk. Next question. A patient undergoing chemotherapy experiences myelosuppression due to impaired DNA synthesis. The drug interferes with ribonucleotide reductase, which base formation is directly impacted. A. Adenine, B. uracil, C. thymine, D. cytosine. Answer C. Thymine. Explanation. Hydroxyurea inhibits ribonucleotide reductase, reducing DNTP production, particularly DTMP, which leads to thymine shortage. Next question. A patient with megaloblastic anemia is found to have erotic aciduria. Which nucleotide synthesis pathway is defective? A. Purine salvage, B. pyrimidine synthesis, C. urea cycle, D. DNA repair. Answer B. pyrimidine synthesis. Explanation. Erotic aciduria is due to UMP synthase deficiency, impairing pyrimidine synthesis and DTMP production, causing anemia. Super high yield. Next question. A mutation results in an enzyme that can no longer methylate uracil. What nucleotide will be deficient as a result? A. cytosine, B. adenine, C. thymine, D. guanine. Answer C. thymine. Explanation. Thymine is derived from the methylation of uracil. Failure to methylate leads to thymine deficiency and impaired DNA synthesis. Thanks for your time. See you on the next page.